Nephrotic syndrome. What do you understand by nephrotic syndrome? First initial thing you have to remember is nephrotic syndrome is not a single disease. It, as the name says, syndrome. It is different, the condition which occurs in different group of diseases. Okay, different group of conditions, diseases also. See here, in nephrotic syndrome, I will make every point clear. Only main thing you have to do is take a pen and paper and write along with me. See, in nephrotic syndrome, proteinuria, and there will be hypoalbuminemia, and also there will be generalized edema, and also there will be hyperlipidemia, and also lipiduria. See, in the nephrotic syndrome, the characteristic feature is loss of protein in the urine. Why the protein is lost in the urine, we will know. But first understand what is happening, and next we will know why it is happening. Okay, in the nephrotic syndrome, what is happening due to some XYZ reasons? That XYZ reasons I will tell, don't get tensed. See, due to some XYZ reasons, the protein is being lost. So first point we got, some due to some reasons protein is lost, so there is proteinuria, that is loss of protein in the urine. Okay, what protein is being lost in more excess quantity? Albumin is lost. First point. Okay, now I understood. Proteinuria is there, mainly albumin is being lost. Okay, so hypoalbuminemia, that is in the blood, albumin level is decreased. Okay, why edema is occurring? See, this is the blood vessel, this is the albumin, so it maintain plasma oncotic pressure. What it is doing, it is maintaining plasma oncotic pressure. So the fluid in the blood vessel is not leaking out into the tissues. But now what happened, the albumin is lost, so the fluid leaks out, so there is edema. Now we got 3 points. We got proteinuria, we got albuminemia, we got edema also. Then why hyperlipidemia? Our liver thinks that, oh, in my urine there is loss of albumin, so what I have to do, I have to increase the synthesis of albumin. So what this liver do, increase synthesis of albumin. Okay, it increased the synthesis of albumin. Okay, it is also fine, but along with albumin it also increased lipoproteins. So this is the reason why hyperlipidemia is occurring. Now we got hyperlipidemia and these 3 points. Then why lipiduria? Lipid is lost in the urine, so lipiduria. As this protein is being lost, this lipid molecules also are being lost. Okay, there is a specific characteristic feature in the polarizing light microscope. There is a characteristic feature, that is Maltese cross appearance. What is this Maltese cross appearance? See, under polarizing light, when we see the molecules in the nephrotic syndrome, the lipid molecules in the nephrotic syndrome, they appear like this. See, this circle like shapes are there, right? They will be pale. the light can pass through them. Here, if all these junctions are forming a line, two lines, right, like this, this is nothing but maltase cross appearance, and this is the total lipid molecule. This is characteristic feature in nephrotic syndrome, and when observed the fat molecules under polarizing light microscope. Okay, this is one thing. Now what all we covered? We covered what happens in nephrotic syndrome, and the future, one of the future we discussed, and now we'll discuss about what are the reasons of this nephrotic syndrome. The reasons are membranous nephropathy. Okay, nice. Then membrane proliferative glomerulonephritis, the second point. Don't get tensed. What is membrane? What is this what is this membrane? What is this membrane? I will make it clear. Don't get tensed. In my lectures, I will tell the meaning of each and every word, so that you no need to buttify, or you can get the concept very clear. Okay. Membranous nephropathy, membrane proliferative GN, and then um, focal segmental glomerulosclerosis. Then, okay, these are the primary causes. Okay, there are two types of causes. One is primary cause, and second one is secondary causes. Here, membranous nephropathy, membrane proliferative GN, and the fourth one is minimal change disease. You might think, what all these disorders are. In the starting only, I told that there is loss of protein, right? That loss of protein can be seen in this. That loss of protein can be seen in this through the kidney. So they are classified to causes of nephrotic syndrome. Might be causes of nephrotic syndrome. This is the first primary causes we understood, and every single disease I will explain. In the secondary causes, there will be amyloidosis. That means secondary, in the sense secondary to these diseases, the nephrotic syndrome is occurring. So those are secondary causes. SLE, diabetic nephropathy, then drugs like NS, non-steroidal anti-inflammatory drugs, and hepatitis B, V, C, any of this, hepatitis B or hepatitis V or hepatitis C infections. Okay, these all might be the secondary causes of nephrotic syndrome, and these are the primary causes. Okay, what happens in the membranous nephropathy? See, this is the blood vessel that which is entering the glomerulus, and this is the endothelium, and this is the glomerular basement membrane, and here are podocytes. Okay, these are all podocytes. Okay, here also there are podocytes. Now, in membranous nephropathy, this GBM, glomerular basement membrane, will be thickened. How? Abnormally thickened. Now you might ask a question: if the membrane is thickened, anything should not be passed that side, right? Then why there is proteinuria here? See, if there is a mesh like this, if it is thickened like this evenly, okay, as you have doubt, it might stop the proteins from leaking, but it is not normally thickening, it is abnormally thickening. That means the thickening is not linear, it is like this. Okay, even though it is thickening, it is leaving spaces, right? From that spaces there will be leaking of protein. Okay, this is the membranous nephropathy. And membrane proliferative glomerulonephritis. Okay, again once again we'll draw the same diagram. See, this is the blood vessel, this is the endothelium, this is the glomerular basement membrane, and one more here, the mesangial cells. What are mesangial cells? Those are supporting cells in the nephron structure. Okay, now in the membrane proliferative glomerulonephritis, these endothelial cells are there, right? These endothelial cells will proliferate. See, previously the lumen was bigger, right? Previously the lumen was bigger, but due to excess proliferation of this endothelial cells, the lumen size is decreased. Now the next question, why these are actually proliferating? The actual reason is, in membrane proliferative glomerulonephritis, what happened? There will be some infection. Okay, for this separate class is there, but I will make it as simple as possible. There is some infection, so there are inflammatory mediators coming to the glomerulus. In the coming inflammatory mediators, one of the inflammatory mediator is neutrophil. This neutrophil, along with other inflammatory mediators, okay, they will secrete growth factors. See, inflammatory mediators are coming, inflammation is occurring everywhere. After occurring inflammation, they will also, along with the inflammatory mediators, they will also produce growth factors, due to which this proliferation occur. This proliferation has happened, this mesangial cells proliferation is occurred, this one also proliferated, this cells also proliferated. Here the lumen is what narrowed, and here mesangial cells will happen, and due to, I told that inflammatory mediators will be coming, right? Due to this inflammatory mediators deposition, now here also podocytes there. Due to inflammatory mediators deposition, now this podocytes will be effaced. That means podocytes will be okay, I will tell clearly about effacement. See, these are the podocytes. How they are arranged? In a crescentic manner they are arranged. But when this inflammatory mediators deposition is there, they will be effaced like this. They will be crushed. Or effaced. Okay, after effacement, see, previously the slit is only this much, right? Only this much the slit is there, but now here the split is increased this much, so there will be leak in proteins. Okay, there will be leak in proteins, and this is membrane proliferative glomerulonephritis. And focal segmental glomerulosclerosis, I will tell. Focal, that means, okay, listen clearly, there are many glomeruli in the kidney. In that, only some of the glomeruli are involved, and segmental, that means in that only some involved glomeruli, only some part of the glomeruli is involved, and that some part of the glomeruli undergo fibrosis. That means fibrous tissue will be deposited there. See, this is the kidney. There are many glomerulus. We are telling focal, that means only some part are involved. What I told, that means segmental. In this involved some glomeruli only some part is involved, that is segmental. And glomerulosclerosis, that some part undergoes fibrosis, improper fibrosis, which lead to proteinuria. and the remaining process, hypoalbuminemia, hyperlipiduria, that all will take in the same manner. But till here we have to understand. Then minimal change disease in this. Okay, in this minimal change disease, I previously I told about podocyte effacement, right? That one only will be there. In this minimal change disease also podocyte effacement only there, but it is less. That means we can't tell it is minimal change disease. It is due to minimal change disease because the symptoms are very very low and it mostly happens in children. Minimal change in the glomerulus will be there, so that the proteinuria also not that much increased. Proteinuria is not that much high, but it can also contribute to nephrotic syndrome in children, mostly in children. Okay, now we know about the reasons why nephrotic syndrome is happening and how it is happening. And now what we should know about the gross features and also microscopic features. Microscopic features I already told. uh, the glomerular basement membrane thickening, the proliferation, those are only will come under microscopy. And now I will tell about gross. I think it's not working. Okay, I will tell about gross. Okay, first I will tell the points and then I will tell the reasons. First thing, the kidneys enlarged. 2, it is pale. The kidney is enlarged and the kidney is pale. The kidney is enlarged due to what? Inflammatory mediators accumulation. You can also tell it enlarged. But why pale? Here, did I tell anywhere RBCs are been lost? No, I did not tell anywhere that RBCs are lost. Only proteins are lost. Only proteins are lost. Then why this paleness is coming? Means, okay, why I tell here RBCs? If RBC are lost, you can get paleness, right, overall the body. So that might be the reason here also. But I did not tell that RBCs are leaking anywhere. So then why this pale? In the blood there is transferrin. There is transferrin. There is iron. Okay, and there is also erythropoietin. There is erythropoietin, there is transferrin, there is iron. These are lost in the urine. See, here iron is required for RBC formation. This will help in iron transport, and this is stimulant factor, right? So these are all required for RBC synthesis, and as these are lost in the blood, the paleness is there. That is the reason for paleness of the kidney in the cross. I will tell about the complications. What are the complications? See, in the urine, in the urine, immunoglobulins are also lost. What happens due to it? More prone to infections, and clotting factors are also lost. Clotting factors are also lost, and immunoglobulins are lost. Antithrombin 3, clotting factor. Okay, antithrombin 3 is lost, so there might be increased clotting in the body. That might lead to renal vein thrombosis. Clotting factors are lost, so we might land up in renal vein thrombosis anywhere, mostly renal vein thrombosis. And immunoglobulins are also lost. It may lead to more prone to infections, Okay, these are the most important things which we can know. And thank you.